Stacy Ferrant, and I'm here with Dr. Mulder today, who is the veterinarian at the Fairview Drive Pet Hospital, who I work very closely with. And Dr. Mulder is going to be doing a spay on a cat named Boots today. Dr. Mulder, why is it that we've been receiving so many phone calls lately regarding spays and neuters for our pets?
Well, it's a good thing we are. Thankfully, people are recognizing the need to get their dogs and cats spayed. It used to be just from a population control point of view that people wanted to make sure that they didn't have unwanted dogs and cats. But we now recognize so many health benefits of getting your dog and cat spayed, from cancer prevention to unwanted behaviors like urine spraying and such. And so it's a good thing. But the other reason for those phone calls is that it's critically important that you have a veterinarian that you can trust. There's so many decisions made in the course of a spay or neuter surgery that are at the discretion of the veterinarian, and to choose which suture material is not really a choice that we would give to our clients, but the decision in terms of which veterinarian is very important.
There seem to be a lot of decisions that we need to make when choosing the right vet and the right surgical procedure for our pet. Can you go over some of those options that we need to understand?
Yes. It's important to realize that a lot of the things considered options are not truly optional. Pain control, for example, should never be considered an option, and yet when people are shopping around, we've often heard that the price does not always include pain control. Other things such as IV fluids and the type of suture material selected are very important for the care of the pet. But there's so many other decisions that are not even discussed that can make a big difference, from laser surgery, which, although sounds very exciting, can actually delay wound healing, whereas stitches that are buried underneath the skin can actually speed the healing and increase the comfort factor after surgery is done.
So, Dr. Mulder, what is going to happen to Boots after the surgery? Are Boots' parents going to have to take a couple of days off work in order to care for her after the surgery?
No, thankfully. The anesthetics that we have these days are so fast-acting that not only do they go to sleep very quickly from the anesthetic, which is much safer, but they also are out of the body very quickly. And within about a half an hour of surgery, Boots is going to be walking around as if nothing's happened. And that's a tremendous benefit for them. They can go home on the same day then, and usually the next day they spend a bit more time sleeping, but there's no need to take time off work. However, there are the occasional complications to surgery, whether that be oozing from the incision site or in some cases some swelling. The most important thing is that Boots' parents need to feel very comfortable in bringing Boots back in again. As we often say, there's more to pet health care than meets the eye, and that's most certainly true when it comes to spays and neuters. The surgery is a complex procedure, and people need to know what's involved.
Well, Dr. Mulder, I know you always put me at such ease when I have my health care questions for Rocky. I really thank you for joining me today and discussing Boots and helping our viewers to really understand all that is involved in a spay or a neuter for our pet.
Thank you.
Thank you.